Hello everyone! In this video, we will be taking up the side effects of antipsychotics, and to help you remember them, I am giving you mnemonics. Okay, let's start with extrapyramidal symptoms or EPS. These are motor symptoms that are associated with a decrease in the level of dopamine. Remember, in schizophrenia, the dopamine level is increased, right? So antipsychotics will attempt to correct this imbalance by blocking dopamine receptors. This now leads to a decreased dopamine, a neurotransmitter that is needed for movement. EPS is more common in first-generation antipsychotics because this type of antipsychotics cause an indiscriminatory blockage of dopamine receptors. So even those receptors which are not associated with delusions or hallucinations and which are simply doing their job of receiving signals associated with movement regulation are blocked. It is less common in second-generation antipsychotics that target more of the serotonin receptors and less of the dopamine receptors. EPS are classified into four. The first and the earliest is acute dystonia. This is characterized by involuntary contractions in the neck that leads to torticollis or stiff neck. So, we can see clients assuming a fixed head position. Oculogyric crisis consists of exaggerated eye rolling. And the third symptom is tongue protrusion. Use the word NET as an acronym to remember the affected parts. N is for neck, E is for eyes, and T is for tongue. Imagine a fish caught in a net, eyes and mouth wide open. The onset of dystonia is early. 50% occur within 48 hours and 95% within 96 hours. Treatment is to discontinue the medication or give benztropine or diphenylhydramine. The next extrapyramidal symptom is akathisia. The symptoms are subjective sense of restlessness, urge to move, inability to sit still, and there may be discomfort but no pain. To remember this, think of the acronym akapesia. It's like someone who drank a liter of strong coffee. If you do this, then the possibility is that you will really feel restless, you will not be able to sit still, and you will be keeping on moving and moving. This occurs within a few days to 2 weeks, and the treatment is to discontinue or reduce the medication and give propranolol. The next extrapyramidal symptom is Parkinsonism. Parkinsonism mimics Parkinson's disease. The symptoms are the following. First is masked facial expression, wherein there is almost no facial expression at all. There is also stoop posture. There's a shuffling gait. When the person walks, he takes very tiny steps and he drags his feet. He hardly lifts his feet off the floor. And it's also very noticeable that the person's arms are hardly swinging. There is bradykinesia or slow movements, and there is resting tremor. Resting tremor means that when his hands, for example, are not supposed to be moving, they start to shake. But when he does voluntary movements of his arms, then the tremors disappear. So to help you remember this, all beginning with letter S. Small facial expression, stoop, shuffling, slow, and shaking. These symptoms develops from days to weeks, and the treatment is to reduce or discontinue the medication. The last extrapyramidal symptom is tardive dyskinesia. Tardive because it occurs late. The onset is after several months or even after several years. Dyskinesia because these are abnormal movements. These movements are involuntary, such as smacking of lips and grimacing. So that means because they are involuntary, this cannot be controlled by the person. So imagine if you develop tardive dyskinesia, which may become irreversible, and that means that for your whole life, you are going to have those involuntary movements. Treatment is to discontinue the medication as soon as these involuntary movements are shown because we are trying to prevent this from becoming irreversible. To help you remember this, let us say the word tardive dyskinesia. But let's emphasize the pronunciation. And let's slow it down. Open your mouth wide and say tar. Then say div and say ve. Say this, ki, ne, sha. All right? Put them all together, opening your mouth wide and exaggerating the movements. Tar, di, ve, dis, ki, ne, sha. Those are the movements that are made by clients who have tardive dyskinesia. The next set of side effects are the anticholinergic side effects. But before we proceed to this, let's go back to the extrapyramidal symptoms. To help you remember the order in which the symptoms appear, just think of them as being arranged alphabetically. The earliest is acute dystonia, and the latest is tardive dyskinesia. Now let's go to the anticholinergic side effects. Anticholinergic, anti-acetylcholine. There is a decrease in the level of acetylcholine because some antipsychotic drugs also block acetylcholine receptors. And this will now lead to decreased sweating, salivation, bronchial secretions, GIT motility, and ability to urinate. Think of the acronym DRY and HARD. Dry skin, decreased sweating. Dry mouth, decreased salivation. Dry throat, decreased bronchial secretions. And hard to defecate because of the decreased GIT motility. And hard to urinate. There could be urinary retention. There is also increased heart rate and increased pupil size. So think of the acronym LOVE is blind. Love is for the heart, and when your pupils are dilated, the tendency is that your vision is going to be blurred. So you become partially blind. There are also anticholinergic side effects in the central nervous system. And think of a client with Alzheimer's to remember this. There's impaired concentration, there could be confusion, there's attention deficit, and there is memory impairment. The next set of side effects is known as the metabolic syndrome. Here, the blood sugar is high, there is hypertension, the person is obese or overweight, especially around the waist, and his triglycerides are high. To help you remember this, the acronym is SWEET and HOT. SWEET stands for hyperglycemic, H is for hypertension, O is obese, and T is triglycerides are high. Or you can simply remember SHOT. There could be sexual and related side effects, such as impotence, wherein the person may have no sexual drive, or in the presence of sexual drive, the person may have failure of erection. There could be ejaculatory problems, such as the client may be unable to ejaculate, or there may be priapism, which is sustained erection. There could be amenorrhea, and there could be gynecomastia in the male, which is enlargement of the breast. And both males and females, there could be galactorrhea. Galactorrhea is breast milk secretion, which is unrelated to pregnancy and lactation. To help you remember the organs that are involved, think of the acronym sex in a pub. Pub, P stands for penis, U is for uterus, and B is breast. Occasionally, antipsychotics may lead to life-threatening side effects. One of these is a granulocytosis. This is a form of severe neutropenia. Neutropenia is a condition wherein the neutrophil count is less than 1,500 per microliter. In a granulocytosis, the count is less than 100 per microliter. So what's the implication of this? Neutrophil is a type of WBC. Our WBCs consist of neutrophils, basophils, and eosinophils, of which neutrophil has the greatest number. So, when there is a drastically reduced count of neutrophils, then what would be the effect? We know that WBCs are responsible for protecting us against infection. Therefore, the person is high risk for infection. Even infections that are not supposed to be harmful or are not supposed to be life-threatening could be life-threatening for the client because he has very low defense. So you don't need actually to look for any acronym for this or any mnemonic for this, you just remember the signs and symptoms of infection. This could be fever, chills, malaise, sore throat, mouth sores, bleeding gums, bone pain, and tachycardia. Another rare but life-threatening side effect is neuroleptic malignancy syndrome. This is a condition wherein within hours, usually after being exposed to a dose of neuroleptic, or that is another term for antipsychotic, a person develops this set of symptoms: rigidity, extrapyramidal symptoms, delirium, sweating, hyperthermia, tachycardia, and an elevated serum creatinine kinase, also known as serum creatinine phosphokinase. To help you remember this, look at the acronym RED. The triad could be reduced into fever, rigidity, and altered mental status. This is an emergency situation, and the management is to immediately discontinue the drug and provide supportive measures based on the symptoms manifested by the patient. So these are the side effects of psychotropic or antipsychotic drugs. Please like and subscribe.